We will discuss on PTSD. Let's start. Post-traumatic stress disorder, PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self-care, they usually get better. If the symptoms get worse, last for months or even years, and interfere with your day-to-day functioning, you may have PTSD. It is a mental health condition that can develop in some people after they have experienced or witnessed a traumatic event. Traumatic events that can lead to PTSD include combat experiences in military personnel, sexual assault or abuse, physical assault or violence, natural disasters like earthquakes, hurricanes, serious accidents like car crashes, witnessing a traumatic event like a terrorist attack. PTSD can affect individuals of all ages and backgrounds. It is characterized by a range of symptoms, which can be grouped into four main categories. Intrusive thoughts. People with PTSD may experience recurrent, distressing memories of the traumatic event, nightmares, or flashbacks where they feel like they are reliving the trauma. Avoidance and numbing. Individuals with PTSD often try to avoid situations, people, or places that remind them of the traumatic event. They may also become emotionally numb, feeling detached from others and losing interest in activities they once enjoyed. Negative changes in mood and thinking. This can manifest as negative thoughts about oneself or others, feelings of guilt or blame, and difficulty concentrating or remembering things. Increased arousal and reactivity. People with PTSD may be easily startled, irritable, have trouble sleeping, and engage in risky or self-destructive behavior. They may also experience heightened anxiety and a constant sense of being on edge. The symptoms of post-traumatic stress disorder, PTSD, can vary from person to person but generally fall into four main categories: intrusive thoughts, avoidance and numbing, negative changes in mood and thinking, and increased arousal and reactivity. Here's a breakdown of these symptom categories. Intrusive thoughts. Recurrent and distressing memories. Individuals with PTSD may experience intrusive and distressing memories of the traumatic event. These memories can pop into their minds unexpectedly and are often accompanied by emotional distress. Nightmares. Frequent nightmares related to the trauma can disrupt sleep and cause further distress. Flashbacks. People with PTSD may have flashbacks, where they feel like they are reliving the traumatic event. During a flashback, they may lose touch with reality and believe they are back in the traumatic situation. Avoidance and numbing. Avoidance of reminders. Individuals with PTSD often go to great lengths to avoid situations, people, places, or activities that remind them of the traumatic event. Emotional numbing. They may become emotionally numb, feeling detached from others and unable to experience the range of emotions they once did. Loss of interest. They may lose interest in activities they used to enjoy and feel disconnected from their friends and family. Negative changes in mood and thinking. Negative thoughts and feelings. People with PTSD may develop a negative view of themselves or others. They may feel guilty, ashamed, or blame themselves or others for the traumatic event. Difficulty concentrating. PTSD can lead to problems with concentration and memory, making it challenging to focus on tasks or remember important information. Negative emotional state. Individuals with PTSD often experience persistent negative emotions, such as fear, anger, or sadness. Increased arousal and reactivity. Hypervigilance. People with PTSD may be constantly on edge, feeling excessively alert and easily startled. They may have a heightened sense of danger. Irritability and anger. They may become irritable and have difficulty controlling their anger or aggression. Problems with sleep. Insomnia or other sleep disturbances are common among individuals with PTSD. Self-destructive behavior. Some people with PTSD engage in risky or self-destructive behavior, such as substance abuse or reckless driving. For a diagnosis of PTSD, these symptoms must persist for at least 1 month and significantly interfere with a person's daily life and functioning. PTSD, post-traumatic stress disorder, is a complex mental health condition, and while it can be effectively managed and treated, it is important to understand that there is no one-size-fits-all cure for PTSD. Treatment typically involves a combination of therapies and, in some cases, medications, designed to alleviate symptoms and improve the individual's quality of life. Here are some common approaches to managing and treating PTSD. Psychotherapy, talk therapy. Cognitive behavioral therapy, CBT. CBT is often considered the first-line treatment for PTSD. It helps individuals identify and change thought patterns and behaviors related to their trauma. Specific forms of CBT, such as prolonged exposure therapy and cognitive processing therapy, are designed for treating PTSD. Eye movement desensitization and reprocessing, EMDR. EMDR is a therapy that helps individuals process traumatic memories by focusing on external stimuli like hand movements or sounds while discussing the trauma with a therapist. Individual and group therapy. Individual therapy provides a one-on-one environment for addressing trauma, while group therapy can offer support and a sense of community with others who have experienced similar traumas. Medications. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, like sertraline, Zoloft, and paroxetine, Paxil, may be prescribed to help manage symptoms of depression, anxiety, and sleep disturbances associated with PTSD. Lifestyle changes. Healthy living. A balanced diet, regular exercise, and adequate sleep can contribute to overall well-being and help manage the symptoms of PTSD. Avoidance of alcohol and drugs. Substance abuse can worsen PTSD symptoms, so it's essential to avoid or limit alcohol and drug use. Mind-body therapies. Practices like mindfulness meditation and yoga may help individuals manage symptoms by promoting relaxation and reducing anxiety. Support system. Building and maintaining a strong support system with friends and family can be crucial. Talking about the trauma with trusted individuals can help with healing. Education and self-help. Learning about PTSD and its symptoms can empower individuals to better understand and manage their condition. Self-help strategies like journaling, self-care routines, and relaxation techniques can complement professional treatment. Seeking professional help. It's essential to work with a mental health professional, such as a therapist or psychiatrist, who specializes in trauma and PTSD. They can provide a tailored treatment plan based on the individual's specific needs and experiences. There are no organic or natural remedies that can cure PTSD on their own. PTSD is a complex mental health condition that typically requires professional treatment. However, Some individuals find that incorporating certain lifestyle changes and complementary therapies alongside evidence-based treatments can help manage symptoms and support the healing process. These approaches are often used as complements to traditional treatments rather than replacements for them. Here are some organic and holistic methods that may be beneficial for some individuals with PTSD. Mindfulness and meditation. Mindfulness techniques and meditation practices can help reduce stress and anxiety. Mindfulness-based stress reduction (MBSR) and mindfulness-based cognitive therapy (MBCT) have been shown to be effective in managing symptoms associated with PTSD. Yoga. Yoga combines physical postures, breathing exercises, and meditation, which can help improve relaxation, reduce anxiety, and enhance overall well-being. Exercise. Engaging in regular physical activity can have a positive impact on mood and mental health. Exercise releases endorphins, which are natural mood lifters. Diet. Eating a balanced and nutritious diet can contribute to overall well-being. Some foods are known to have mood-stabilizing properties, such as omega-3 fatty acids found in fatty fish, and certain vitamins and minerals like B vitamins and magnesium. Aromatherapy. Some people find relief from symptoms of anxiety and stress through the use of essential oils. Lavender, chamomile, and frankincense are commonly used for relaxation. Herbal remedies. While there is limited scientific evidence to support the efficacy of herbal remedies for PTSD, some people have reported benefits from herbs like St. John's wort and valerian root. It's essential to consult with a healthcare provider before using herbal supplements, especially if you are taking medications. Acupuncture. Acupuncture, a traditional Chinese medicine practice, involves the insertion of thin needles into specific points on the body. Some individuals find it helpful for reducing stress and anxiety. Art and creative therapies. Engaging in creative activities like art, music, or writing can be therapeutic for some individuals. These activities provide an outlet for expressing emotions and processing trauma. It's crucial to note that while these organic and holistic approaches may help manage symptoms and promote well-being, they are not a replacement for evidence-based treatments like psychotherapy and, in some cases, medication. PTSD is a serious condition that often requires professional intervention. If you or someone you know is struggling with PTSD, it's essential to seek help from a qualified mental health professional who can provide a comprehensive treatment plan tailored to individual needs. Additionally, consult with a healthcare provider before making significant changes to your diet or starting any new herbal or alternative therapies, especially if you have underlying medical conditions or are taking medications. Recovery from PTSD is often a gradual process, and individuals may experience setbacks along the way. However, with the right treatment and support, many people can significantly reduce their symptoms and improve their overall quality of life. It's important to reach out to a healthcare provider if you or someone you know is struggling with PTSD, as early intervention can lead to better outcomes. Remember that recovery is possible, and seeking help is a sign of strength, not weakness.